Welcome to the Catawba Valley Community College Valley Sim Hospital. This is an area that the college has set up for a lot of our healthcare programs. The respiratory therapy program is actually lucky enough to be housed within the hospital. So we have the ability to be able to have access at all times to all of the different areas. So this is a very beneficial thing for the respiratory therapy program. You can see that in the intro here, in the opening of things, this looks very much like the welcome area that you would see in any hospital, and that is the way it is designed to be. We want this to look just like a hospital. So as we go through the different areas that you will see in the Sim Hospital, you'll see that they look very much like what you will see in an actual hospital, because we want to give the students an immersive situation that they are able to be in. I'm Jason Elder. I'm the program director for Catawba Valley Community College's respiratory therapy program. So first we have the program director's office. The college has been very good of providing us the availability of all of the things that we could possibly need. We have all the computer equipment, and we have a complete library for our respiratory care courses. To the director of clinical education's office. And again, you can see that the college is wonderful about providing us the electronics and everything that we need. The computer setups and the complete library as well. We have wonderful publishing partners that allow us to be able to have the sufficient coursework that we need and all of the workbooks and everything that follows along. We also have storage space in each office. You will have noticed the filing cabinets that we have for our 5 years worth of data that we need to keep on hand, and for all private and lockable files as well. We have secure offices or secure areas in our offices for those. So within our offices, you can see that there are chairs provided also, and this is an area where we provide academic counseling to our students. We are able to talk with them one-on-one, or if needed in groups, if we've had group projects or things like that, that allow us the opportunity to be able to communicate with the students for those individual areas. We also have an additional office which is unoccupied at the moment, that we can add another faculty member eventually, hopefully. And in the meantime, if we have something that we need to do individually with the students to meet, or to have them be able to meet virtually with a clinical partner or anything, we can do that as well. This is Nakanya Godwin. This is also our Director of Clinical Education.
Hi, everyone.
Who is helping me with the video here. Our classroom, as you can see, has lots of open space. We do have enough room right now for the students that we have. You can see the X's on the desk right now at the moment, where we have everything marked off in 6-foot distances for our COVID distancing. We have a tremendous whiteboard. We have in-house projecting. We have the ability to have sound piped in from the videos and everything that we have. You can see we have good speakers. The college, during this COVID pandemic has actually purchased for us the Promethean panels. And for the Promethean panels, it is another way for us to be able to do distance education. It is another way for us to be able to telestrate actually on the Promethean panel itself if we have to do distance learning, so that we can be able to show them and isolate individual things. We can blow up images. It's a really interesting piece of equipment, and it works based off of our computers and everything as well. It also connects up to our WebEx system, which is our connectivity for being able to do the web-based learning whenever we do that. So we have a very sufficient amount of classroom space, and we have a lot of equipment that's available to us, and the college has been very good about doing everything they can to help, especially through the pandemic. All right, so now we are into our laboratory area, and you can see that with the laboratory we have 2 high-fidelity mannequins. We have a SimMan 3G, and we also have a Laerdal Medi, and with those 2 different systems, we actually have the ability to have them to talk and have interactive experiences with the students. Right now, we don't have as many ventilators in the laboratory as we normally would, simply because of the pandemic. During the pandemic, we have loaned out several of our pieces of equipment to the area hospitals to help them with their capacity and their ability to take care of patients. But the students do get to see that equipment. We make sure with our academic partners that they are actually able to get into the different areas and see those pieces of equipment. We do have some that we have available to be able to get them to lay their hands on, of course, and we did keep equipment for the students to be able to utilize. These mannequins will do pretty much anything. They will cry, they'll talk, they'll blink, they'll have pupillary reactions, very high fidelity mannequins. We can intubate, we can talk through the mannequins. We have a area that we will show you momentarily that we have a control room where we can be out of the room and actually allow the students an opportunity to be able to interact one-on-one with the patient just as they would. We have an equipment area set up right now where we were using for our practicum whenever we did our last semester end, and all of our oxygen equipment and nebulizer equipment set up. One of the other things that I'll point out is our oxygen devices, our high flow cannulas. We have a wonderful relationship with a lot of our academic partners and our hospital partners. So one of them was able to, during their negotiations for getting new high flow nasal cannulas, the the Vapotherm system, they were able to negotiate for us to get one as well because they utilize our area for training. So they also were able to have that here. And then one of our industry partners for our advisory committee was able to get us an OptiFlow. So we have two different types of high flow cannulas. The students do get to see all of the different styles and they get to work with them just like they would in the hospitals. With our laboratory, we had talked about the ability of the students to be able to have one-on-one interactions. We also have cameras mounted in the walls. We have cameras mounted in the ceiling, which are covered right at the moment. And then we have microphones mounted in the ceiling as well, which allow for the students to be recorded. You can tell that there are monitors as well. This gives us the ability to run any kind of scenario that we would like, whether it be ICU, emergency department, OR, PACU, any kind of scenario that we would want. We can set the monitor up to look like that, record the students, and then turn around and play the video back with the students and allow them to debrief and actually figure out what they did well and what they did wrong if they didn't pick it up during the scenario. For our equipment area, you can see that we actually have a large area available for the students to have all of the equipment that they could possibly need in the hospitals. We actually have a SPAG unit, which is one of the things that some other programs that I have talked to do not have. We actually have all of the nasal cannulas, the non-rebreathers, Venturi masks, all of our oxygen devices that students could possibly want. We have nebulizers, we have heaters, we have all different kinds of equipment that they may or may not see. We've been fortunate enough to be able to have a oscillator donated to us from a hospital as well. So we are very fortunate with the equipment that we have, and we have a sufficient amount of equipment, I believe, to be able to do everything that we need to do for the students. In our respiratory supply closet, we have ample room for storage. We have areas designed specifically for home care and our first semester type of things, different types of aerosol devices, and resuscitation equipment. We also have all of our oxygen equipment available for our students as they are cycling through the program, and provide them each with their own individual bag of respiratory equipment. The rest of the supply room is dedicated to ventilator, BiPAP, and adapters, suction, ambu bags, resuscitation equipment, heaters, and other types of equipment that we may have. We also provide a little bit of storage for supplies and equipment in this room as well. So this is our control room that we have available for our students, and we have, of course, the mirrored glass where they can't see us, but we can see them. This is our recording system that we have available to be able to record the students, and of course it's shut down at the moment, just in standby. And then we have our two control laptops for our various mannequins that we have in the room. So this little control room allows us to be able to talk back and forth with the students through the computers, allows us to record the students as well, and allows us the opportunity to be able to give them a real life patient scenario situation that they may not otherwise be able to get. Also with Catawba Valley Community College, one of the things that we had during the last visit that we had, it was fairly new at the time, is our simulated hospital. So with the simulated hospital, we actually have a virtual hospital here at the college. This is our acute care area, or our ED area, whichever we would prefer it to be. We've had some things going on, so there's some things out right at the moment. But you can see that we have a control area for the student control, just like we normally do in the control area I showed you in the respiratory care lab. We can also record in this area as well. We have a Pyxis system, which is our medication administration system. They get the real life scenario of having a Pyxis. We actually have 11 rooms for our students to be able to utilize for different patient scenarios and situations. One of the things that we have utilized this area for recently has been doing a lot of interdisciplinary simulation prior to the start of COVID. So we actually will come back here and work with our nursing program. We have had interdisciplinary simulations for different special events where we have worked with not only nursing, but radiography, dental hygiene, CNAs, EMS, law enforcement, and then this is also an area for our community partners, our hospitals and things like that, to come and do training as well. We have utilized this area for that as well and have actually been able to observe some of the stuff they've done. Power outage scenarios and all those different kind of issues. So this is a very tremendous asset for us here at Catawba Valley Community College. You can see that we have a wide array of dummies available for our students to practice on. We have everything from infant, as you saw in our respiratory care lab. We even have a pediatric here in our acute care setting. We also have geriatrics that we can use as well. We've got 2 set up here in our wheelchairs. And we also have the ability to put these in the bed and do different scenarios with them as well. We have a supply area for a lot of different things. This is a little bit smaller, but it allows us an opportunity to give them somewhat of a scenario of what they might see in a supply room. You can even see that we have dummies of different ethnicities so that we can simulate different scenarios that may be specific to a specific race. This is our geriatric that is in our bed currently. So we have scenarios that we are able to do with this as well. And you'll notice in all of our rooms that there is actually piped in air. Our oxygen is not actually oxygen, it is piped in air as well. There is suction set up. We have emergency call systems so that they can actually initiate emergencies from this area. They can call rapid response, they can call a code blue, they can call whatever they need to get the emergency. We have had scenarios before where we have had all of those things happen. We have also had security issues that we have called. That was when we were working with law enforcement as well. We're now entering our ICU/surgical suite area that we have at the simulated hospital. And in this area, you will notice that we have the mannequins set up as well. They are continuing to be high fidelity mannequins. In our emergency room area, they were not as high fidelity. Some are not in that area. But we have high fidelity mannequins all in this area. So we have our EKG machine. We have an old 7200 actually in here. They were doing a movie shoot and we had the 7200 set up in here for that. You can also see that we have a crash cart set up complete with a defibrillator, which is something that is new to us. Again, that was one of our hospital partners that was able to provide this for us, since they do come over here and do training. This was something that was provided by them for their training, but we are able to use it as well. We have another ICU room which has another high fidelity mannequin, all with the air, the oxygen, suction, monitors, IV pumps, everything that we could possibly see. And we have our 840 ventilator set up in this particular room. We were using it for some scenarios with students coming through from high schools. All of the rooms are still recorded. All of the rooms still have sound. And they are all used from a central location again, where we have the ability, one-way glass, computers set up to run each of the mannequins, and a recording system within. Plenty of space for us in here. We've got some supplies out right now that were donated that we've not gotten put in the way just yet. And then the last thing that we have is actually our OR suite, which is something that is extremely beneficial to our students when they get ready to do their intubation rotation, because they're able to actually step into an OR before they get to the hospital. This is an area where we also utilize our surge tech area. You can tell that surge tech has been in here because they've got their sterile tables and everything out right now. Occasionally we will provide anesthesia for them as a simulation. They actually do have mannequins that can be operated on. So they have mannequins that have abdomens that can be opened up, and all of the different internals. You can see our radiography area also participates here. They have a C-arm. We were actually very fortunate to be able to get a Da Vinci robot system that is here that they are able to see and utilize as well. And you can see, of course, when Surge Tech comes over to be able to do their areas and their simulations, that we have hand wash stations and everything for them here, and we have the ability for them to be able to set up what they need to be able to scrub in, scrub out, and to be able to do everything that they need to do. They usually will bring their supplies and set everything up over here just like a surgical area whenever they're going to do their simulations. But we have surgical sinks. One of our last simulation areas that we have that we'll talk about is actually our OB and Bariatrics rooms. You can see, again, this one doesn't have two-way glass. However, the instructors are able to set up outside of the rooms, and our rooms are set up to be able to do anything that we would want to do scenario-wise. So we can do bariatrics, which we very rarely do, but we do have some that we will do. We do a lot of neonate and pregnancy scenarios. So you can see that we have isolettes, and we have computers set up for each of the babies so that the babies are able to do different things. They are high fidelity mannequins as well. We have monitors that are able to show their heart rate, respiratory rate, oxygen saturations, all the different stuff that we would need. The babies actually have pulses in their umbilical cords, in their arms. They are able to show cyanosis. They will turn blue and they will seize. So we have all kinds of abilities with our students to be able to do these different things. So in this room, we actually have set up for a delivery that has already happened. We do have mannequins that are actually able to give birth, and they are controlled from a remote system as well, but then we have the babies as well for them. And we have a radiant warmer available to us in order to be able to give the simulation of the radiant warmer in the delivery room as well. So the college has also been very generous in the amount of space that we have. This is only one of our 3 computer labs that we have available for our students. And you'll notice that there's lots of computers in here. We have the ability to be able to present from inside this room. This is a lot of times where we will actually do our proctored testing on the computer as far as their simulated boards and things along those lines. There's plenty of room for us to spread them out, plenty of room for the students to not be where they can see anything else. And the instructor has access to a computer all of their own that they can monitor and observe all of the different areas in the room. So we have a rather large area. Like I said, this is only one of 3 computer labs, and most of them have about this number of computers. So during the pandemic, one of the things that we have actually been able to do is utilize our lecture hall that is on the same floor as our classrooms and our labs here in the hospital. So you can actually see that we have a large area that we are able to put students into. They're able to socially distance, and they are able to get lectures from here. This particular room has microphone access so that I can have a microphone and make it to where they can be heard, or that I can be heard throughout the entire classroom. We have projection equipment. We have a large area of whiteboard that is actually, this particular whiteboard will slide back and forth. So I actually have 4 different whiteboards available of that size in this one particular room. So with this particular area, this allows us a lot of different area. to be able to educate our students from. So one of the things that we have for Catawba Valley Community College is our student is situations. And this is basically laying out that we always want to be here for our students. We want to have open door policies for them. We want to be tolerant of things that they have. We want to make sure that the student is taken care of, because that is our future as educators, is taking care of our students and making sure that our students have a safe environment to be in, and that our students feel like they can talk to us at any time about anything. We are actually located on the 5th floor of the simulated hospital, and we have access to a lot of different areas in the hospital or also in the building. So one of the areas that we're going to access on our 2nd floor is our library. They have access to all kinds of resources. Our library staff is very diligent about providing a lot of resources to our students. They have LibGuides that they actually have developed for different programs in the college. They are very adamant about having the students have the ability to be able to have online access for research, and they do a very good job of actually coming and doing a guided session of how to do research in different areas to find things and what are available through the college for them to be able to have access to all of the different research options. So our NC Live database, the Cochrane database, all of the different things that we have as far as research. We are having different availabilities for the students, and they just have to make a little bit of an appointment, make their scheduled times now for those times whenever they need to get in and do various things. We have study areas within the library. You can see that there are tables and everything set up for the study areas. We also have different rooms set up to where the students can actually go into the individual rooms and have a quiet study area themselves. We also have another conference room that is actually in the library where we do our Kettering review, and it's locked at the moment because we're in our off time for the Christmas holiday. So we actually have another conference room, though. It's a very large area, lots of round tables set up, projection equipment set up where we can project on all 4 walls. So lots of different areas that we have to be able to project to, and different ways that we can seat the students and get all of that information to. We're going to go into our library momentarily and show you the resources that the students actually have. So we have a vast library with what we have available here. And then we have areas where the students can actually sit quietly and study if they need to. We have lighting for them in different various ways, lamps or outside light, natural light. So we have a lot of resources available to the students.